If you have followed all the recommendations for basic dry eye treatment and are still having problems and don't want to take pharma, the next step is a more premium treatment or regenerative one. Or if you've done it all, the gland expressions, Blefex, taken Lotemax, Restasis, or Xiidra, and are still having problems, the next step is a more premium or regenerative treatment. Premium treatments are iLux and LipiFlow. Think of them as high-end gland expressions. These work well when your meibomian glands are plugged, or when the oil is not flowing, or is just too thick and stagnant to flow. LipiFlow is a thermal pulsation device computer operated, where iLux is a handheld device operated by the doctor. Both of them are designed to heat and apply gentle pressure to the eyelids to open the blocked meibomian glands. We do this to have a better tear film, and when the oil is flowing, we just see better and have less irritation symptoms. The doctor has complete control with iLux and can target areas specifically that are plugged. The treatment takes approximately 8 to 12 minutes for both eyes. Before treatment, the doctor will review your images to determine the treatment zones. Your eyelid will be held between the soft silicone pads similar to contact lens material. Then the therapeutic light-based heat will begin to warm the blocked glands to a safe temperature. It will hold this temperature for 40 seconds until all the plugged oil has melted away. Once the oil has melted, your doctor will apply gentle pressure to release the clogged oils. The eye will be rinsed and the treatment is complete. This is best treatment for spot areas on the eyelids. The results offer relief in 4 to 7 days after treatment, and they last for approximately 6 months to a year. At that time, they will need to be repeated. This works better than the standard in-office gland expression, as it heats the eyelid with control from both sides. Thermal expressions do offer immediate relief for plugged glands, but they do not treat underlying inflammation. These treatments work best in conjunction with IRPL therapy, which reduces the inflammation and stimulates the gland growth, or when no inflammation is present and the only problem is plugged stagnant glands generally found in long-term computer users or gamers. iLux offers the same results of LipiFlow for approximately half the cost. Following an iLux treatment, you will need to add oil drops, MGD, 4 times a day for a week. This treatment has cleared your stagnant oil, and now your lids need to remake some good quality oil that's not plugged up and thick. This takes a few days for the glands to replenish. IPL stands for Intense Pulsed Light and is light-based technology commonly used in dermatology to treat rosacea and reduce telangiectasia, which is superficial spider-like blood vessels that occur on the skin. IPLs are now being used by optometry and ophthalmology to treat meibomian gland dysfunction and mixed causes of dry eye. The standard skin IPLs have advanced to a new IRPL, Intense Regulated Pulse Light, called EI, which came to market in 2014. EI is a device that generates a new type of polychromatic pulsed light by producing perfectly calibrated, homogeneous sequence of light pulses. The sculpted pulses are delivered under the shape of a regulated train pulse. The energy spectrum and time period are precisely set to stimulate the meibomian glands to improve their function, unlike the original IPL, which only is designed for skin. The proposed mechanism of action of the EI is neurological. Localized treatment is directed to the lower arcades of the parasympathetic nerve. Infrared nerve stimulation induces return to normal activity of the meibomian glands. The original IPL needs to add an infrared mask to achieve the same results, lengthening the time of each session. IRPL treatments improve meibomian gland function and reduces inflammatory cascades, 20 to 25% more effective than the conventional IPL. The benefits of the EI include 86% of patients report significant improvement in eye comfort and vision clarity. It's safe and comfortable, FDA approved. Reduces your dependency on eye drops. 55% of patients no longer need to take drops after their treatments. It treats the root cause of the problem, stimulates the glands and the nerves. It's a quick lunchtime treatment with no downtime. What to expect during an EI procedure. You may experience a warm sensation as 5 light flashes are applied to your skin below each eye. The treatment is gentle and you should not feel uncomfortable. Ultrasound jelly is applied under the eye to help soothe the skin. Each session lasts approximately 10 minutes. Following the treatment, a meibomian gland expression is done. In this procedure, tiny paddles are used to compress the lower and upper eyelids to squeeze the stagnant contents of the meibomian glands. The purpose of meibomian gland expression is to accelerate your skin and eyelid healing process. Plan on being in the office for approximately 30 minutes. You may experience a mild discomfort to the eyelids for 1 to 2 days following the procedure. Most patients are able to resume their daily activities immediately after the treatment. Sunlight should be avoided for a few days following the treatment, and sunscreen is very important to be worn. For optimal results, depends on compliance with the specific protocol. This protocol consists of 3 sessions as follows. Day 1, day 15, day 45. Approximately only 10% of patients need a 4th treatment at day 75. Maintenance treatments usually occur once a year and they're recommended for optimal long-term results. However, some patients have great comfort for up to 3 years. Cost per treatment is usually in the mid-200s. There are 3 treatments for ocular surface disease in the end stage. That is to no function of the lacrimal or meibomian glands, and the symptoms are severe and vision is decreased. They are amniotic membranes, autologous platelet-rich plasma, and scleral contact lenses. What is Procara? Think of it as a biological corneal bandage lens made from amniotic membrane, which has natural anti-inflammatory and healing properties. It helps restore the cornea and return the eye to normal, healthy state. An amniotic membrane is part of the placenta that surrounds and protects the baby during pregnancy. The tissue is donated by consenting mothers and goes through stringent health screening and testing. What to expect? It is similar to a very large contact lens. Only one eye is done at a time. The contact lens is worn for a period of 3 to 5 days, and the lid is partially taped closed for comfort. You will be aware of the lens, but it is not painful. It will be a week of chilling out. Then the contact lens is removed in the office. The cost is approximately $1,000 per contact lens. If there is little gland function remaining,
and the cornea is compromised, another treatment option is autologous serum tears, auto platelet-rich plasma, which are preservative-free biological eye drops made from small amount of your blood. There is an office downtown Vancouver that I can refer you to for this. Cost is approximately $500 for 10 weeks of eye drops. Presently, we are unaware of how often the drops need to be repeated. Lastly, if there remains no gland function, we have scleral contact lenses. Dr. Hughes and Dr. Nadeau at Poco Vision Care can do these. A detailed map of your cornea is taken with the topographer, and special contact lenses are specifically made for your eyes. Think of these lenses as a bowl full of liquid to bathe your eyes all day long. As they are contact lenses, most extended insurances will cover a portion of the cost, which approximately run at $850 for a set of lenses.